Is it not mind-boggling how a doctor can retain so much information and diagnose your issue that day? This is exactly why I picked the career of an orthopedic physician. With the lifting of the leg, Dr. Melton gave 3 prognoses of my leg injury while weightlifting. Today I'll be discussing 3 things: the job description, the requirements, and the pros and cons. Recently, the Merriam-Webster Dictionary defines orthopedics as marked by or affected by skeletal deformity, disorder, or injury. First, let's take a look at the job description of an orthopedic physician. There are several duties that need to be done on a daily basis. These would include listening to patients' issues, taking their medical history into account, and providing a plan of issue of treatment. Surgery is determined by diagnostic tests such as x-rays and MRIs. MRIs are just like an x-ray, except they have a detailed skeletal muscles in it. These doctors advise stretching, prescribe medication, and physical therapy. Recently, the Lee Summit Medical Center published an article declaring our orthopedics are extensively trained in procedures that will restore your mobility, flexibility, and quality of life. Next, let's take a look at the requirements. First, there are many skills required to become an orthopedic physician. They must be excellent communicators, show empathy, meaning they have understanding, and be compassionate toward their patients. And they must also be great problem solvers. Recently, the U.S. Department of Labor agrees in their occupational handbook, investigative occupations frequently involve working with ideas and require an extensive amount of thinking. The education required takes as little as 11 years. Doctors must do extremely well in graduate school to be admitted. They don't need a specific degree, although they must be very knowledgeable in chemistry, biology, physics, and mathematics. Next, they must submit their MCAT, or Medical College Admission Test score, to a medical school, where they will do 4 years of med school. And there they will be studying in laboratories, classes, and doing practical skills such as diagnosing illnesses and injuries. Next, they will do 3 to 8 years of residency. Residency means they work under the supervision of trained professionals, diagnosing more injuries and treating more illnesses. Now that we've taken a look at the requirements, let's take a look at the pros and cons. There are a few downsides of becoming an orthopedic physician. These would include 8 years of studying, which is an extremely long time, and it's extremely stressful since you're dealing with patients. Although, on the contrary, the outlook is bright. Recently, the Bureau of Labor Statistics states in their occupational handbook that job growth will occur because of continued expansion of healthcare-related industries. The job will increase by 24% in 10 years, or meaning from 700,000 to 900,000 physicians. To bring things to a close, becoming an orthopedic physician is rigorous and time-consuming. This investigative career has many duties needed to be met. And also, to be qualified, it's extremely competitive. This detail-oriented career has many skills needed to be met. And again, this career we have talked about the job description, the skills required, and the pros and cons of becoming one. Thank you all for your time.